Thank you for this honor. Before sharing personal crucible moments, I must acknowledge the dozens of colleagues, mentors, and thousands of participants who have been part of our research endeavors. I'm immensely grateful and inspired to try harder to make this world better for as many of us as possible. As a social scientist, my purpose is to tell stories. My own research has focused on understanding the lives of adolescents and young people living in adversity, so that we can all truly see and hear them for the amazing, complex human beings that they are. Our research hopes that by taking into account their lived experiences, we can design services and support systems that allow them to live, achieve their potential, and thrive. As a quantitative social scientist, I pride myself in spotting patterns in the data that our incredible teams collect. I take on the task of talking about crucible moments in my own research career with the same methodology, though you may agree that with a sample of one, my data is quite biased. I left my country of birth, Albania, at the age of 16 to complete high school in the UK. That was probably the biggest and greatest test of my life. The cognitive dissonance of coming from a loving but low-income home and community, but having to make it in a competitive elitist educational environment, exposed me at a young age to many of the issues that my research currently centers on for adolescents in our communities: mental health challenges, self-image and development of a coherent, if we can, personal identity, understanding and taking care of one's health, including sexual and reproductive health, and then particularly relevant in adolescents' lives, if you can try and remember your own, trying, starting, ending, and trying again with romantic and sexual relationships, and most importantly, using education as a vehicle for transformation. I often speak to my partner, friends, and colleagues about how we think of ourselves as accidental academics. We've arrived at this point in our professional lives not simply through the myths of merit and hard work, but through luck, fortune, and at times the fall of the dice. A constellation of factors, experiences, and opportunities, a pattern, to sound like a quantitative social scientist, had to align. Rather than individual moments, my path to this moment in my academic career has been paved by many realizations and finding connections that drive me to try another day. The lives of the young people that take part in our research are the same. They are not the product of one individual event, but complicated, often unpredictable journeys, full of moments, sometimes convenient, sometimes crucible. I like to say that I'm Albanian by birth, but South African by choice. While pursuing my pre-med undergraduate studies in the US, I was given my first opportunity to visit South Africa. Here, I had the privilege to shadow the most inspiring Dr. Mitch Besser, who set up Mothers to Mothers, an NGO that supports mothers living with HIV and their children. In the first 2 sites of what is now a multi-country program, changing the lives of mothers living with HIV and their children, we set up to measure who was attending our interventions with a simple board in each clinic. Observing Mitch and the team and the work that they did within and beyond clinics cemented my desire to be a medical doctor. After all, that is what any Albanian who is good at maths and science does. I returned to my undergraduate studies to try and get the perfect results required for admission to medical school. In my short time in South Africa, I met many wonderful people, some of whom would connect me again to my future mentors a decade later. My crucible connections with mentors have made my being here today possible. Thank you to all who have done this over the years: Mitch, Lucy, Rebecca, Kathy, and many others. I cannot wait to pay this forward through our research and teaching and supervision at UCT and beyond. A year after leaving South Africa, I found myself crying at a final interview for a fellowship to work at an NGO in Southeast Asia. I had arrived at the interview with the intention of giving up the post, or the chance to have the post, so that I could stay in the US to get into medical school and not lose my visa. I left the interview with an offer to move to Laos, a small country in Southeast Asia, where I would live for 4 years. It was a terrifying moment where choosing to take up an exciting post in a new country meant a postponement, which became indefinite, of my career as a medical doctor. I have never looked back. Well, other than when I was really tempted to become a midwife after the birth of our first child. Supporting young women, especially when they become mothers, to have safe and healthy relationships is the reason I get up and do my work every morning. My own experiences of pregnancy and motherhood have confirmed the immense need for our societies to do better for all women and men and their families, but in particular for these young mothers and their children, our future. Thank you.